Are the harms of lockdown worse than the virus itself? That's today's survey question, and I'm Michael Smerconish in Philadelphia. We're 10 days away from the election, and the U.S. is now in the midst of the long-dreaded fall surge. The U.S. has hit a major milestone yesterday. It recorded its highest one-day number of COVID-19 infections, more than 83,000. This shattered the country's previous record set in July by more than 6,000. Plus, more than 41,000 COVID-19 patients were in hospitals yesterday. And experts warned that the daily numbers will get worse, saying the culprits for this rise in new cases are indoor socializing, outbreaks at schools, and pandemic fatigue. That sounds like a case for additional lockdown. And indeed, this weekend, millions of Europeans are facing tougher coronavirus restrictions. Wales is beginning a 2-week lockdown. Manchester, England is back under the highest tier of restrictions. And Ireland has also imposed its strictest level of restrictions in weeks. But a proposal written by a group of well-credentialed scientists says there's a solution to pandemic fatigue, quote, allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at highest risk. The document is called the Great Barrington Declaration. The original authors are 3 physicians from Stanford, Harvard, and Oxford. They advocate for what they call focused protection. Quote, the most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are at highest risk. The manifesto's central tenet is that not returning to normal life is doing more harm than good, resulting in long-lasting physical and mental health problems. Therefore, the declaration says, restaurants and other businesses should open. Arts, music, sport, and other cultural activities should resume. People who are more at risk may participate in if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. Publication of the Great Barrington Declaration drew swift response in the form of something called the Jon Snow Memorandum. No, not a Game of Thrones reference. This is a tip of the hat to Jon Snow, who was a legendary epidemiologist. The signatures to this document say the Great Barrington Declaration would endanger Americans who have underlying conditions that put them at high risk from severe COVID-19 and result in perhaps 500,000 deaths. Quote, in addition to the human cost, this would impact the workforce as a whole and overwhelm ability of healthcare systems to provide acute and routine care. Furthermore, there's no evidence for lasting protective immunity to SARS-CoV-2 following natural infection. Such a strategy would not end the COVID-19 pandemic, but result in recurrent epidemics, as was the case with numerous infectious diseases before the advent of vaccination.
The coronavirus response coordinator, Dr. Deborah Birx, had this to say about combating this dangerous new surge we are now seeing. Listen to this.
It won't be as simple as closing public spaces, because public spaces, you can see, were very safe over the summer and probably remain safe. This is really something that has happened in the last 3 to 4 weeks, and what has happened in the last 3 to 4 weeks, it's gotten cooler, and people have moved their social gatherings indoors.
It sounds, Dr. Wen, like health measures targeting, let's say, bars or restaurants, for example, won't have an impact if people are getting together in their own homes, indoors. Is that right? How serious of an issue is this right now?
Well, it's a very serious issue, Wolf, because we are seeing explosive spread throughout the country. And unlike before, where we had just a few places that were virus hotspots, we now have virus hotspots all across the U.S. And we also know that what's driving this latest surge are these informal gatherings. The good news here is that we actually know what it takes, and we've done a much better job in formal settings on public transportation, in restaurants, in a lot of other grocery stores, as an example. We've done a lot better in these settings, but we now need to focus on these informal settings. I think many people have a form of magical thinking. We think that, well, our loved ones are people that we trust. They can't possibly have coronavirus. But there's no face of someone who has COVID-19, and we need to use just as much caution around our loved ones. And so that means being outdoors to see them as much as possible. If there's bad weather, rescheduling until it's a better day to see them outdoors. And if we're indoors, we need to limit that time and wear masks, even if it's with people that we know and love.
So what options do people have to socialize when the weather doesn't cooperate, when it's getting colder outside? Are we just not supposed to see people in person throughout these coming months of winter here in the United States?
Well, we are in for a very difficult winter ahead, and I think it is important for us to keep in mind that we have to get through this winter, that by next winter, things could be very different. We most likely will have a vaccine, we'll have other therapeutics, but we have to get through the next several months. So it is really important to try to be outdoors as much as possible. That's the safest way to socialize, at least 6 feet apart outdoors. We can bundle up, use heaters, and again, try to do our best to be outdoors. If we have to be indoors, there are a few options. You can form a pandemic pod with a family or others that you really trust, and everyone limits their risk, recognizing that if one person in that pod has risks, that's the risk that's going to be exposed to everyone else. You can also, if people really want to get together over the holidays, everybody could quarantine for 14 days and then get tested and then see one another indoors. But that's really difficult and impractical for a lot of people. And so I would really encourage everyone, try to be outdoors as much as possible and recognize that it's not for forever, but it is going to be for the next several months.
Yeah.
Let's discuss the problems in Europe and the apparent surrender to the virus by the United States with the spokeswoman for the World Health Organization, Margaret Harris, who has been, I hate to say this, a regular guest on this show. And it's good to have you. I wish we hadn't had to speak to you as often as we have over the last 9 months, but it is very good to have you. And I'm really honoured that you've made yourself available once again at what is such an important time. Margaret, White House Chief of Staff Mark Meadows has said that the US will not be able to control this virus until it gets a vaccine. Your response?
Hello, Becky, and despite the reason, it's always a pleasure to be with you and your viewers as well. Our response is to every country, and it is a very frightening time, but our response to every country is it's never too late. We have seen, even with countries that had enormous outbreaks, had intensive care units overflowing, things looking dreadful, they were able to turn it around when they kept at the things that work, and that's the testing, the tracking, the tracing, bringing the community together to understand what they need to do, to genuinely self-isolate when they've been a contact, to genuinely avoid close contact, avoid crowds, avoid the poorly ventilated spaces, and wear the mask.